What's the best lip filler?
The desire to have more attractive lips makes billions of dollars for companies in the business of selling lipstick. Fuller lips are generally appreciated as desirable and youthful. However, the most significant concern for anyone interested in lip volume enhancement, who I see in my practice, is the fear of looking like a duck. They often will tell me how they or someone they know got a particular product placed into their lips and that they ended up looking crazy. Which then leads to the next question. What's the best lip filler? I'll discuss the products I use in my practice and why the question, what's the best lip filler, is the wrong question to ask. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. Throughout my career, I have used a wide range of non-surgical and surgical procedures to enhance lips. This includes the original collagen injections, such as Zyplast and Zyderm, as well as surgical implantation of fat as well as tissue harvested during facelift surgery called the SMAS, and as well as commercially processed human tissue. That all changed after the introduction of hyaluronic acid fillers in the United States in the mid-2000s. Whether it's for lips or any other area, it's important for consumers to understand that the producers of hyaluronic acid products are creating, through advertising, a perception of product as being more important than anything else. This includes the qualifications of the person actually performing the procedure. Since the companies are not subject to any licensed professional standards, they don't care who uses their product. What only matters to them is for consumers to ask for their products by name. This is a problem. The general public looks for the product without understanding the more important details of who is actually doing the procedure. This has turned out to be disastrous, with so many avoidable complications resulting in disfigurement and even death from filler injection. Think about it. When a disastrous event occurs, the person experiencing the problem is no longer content to look for someone like the person who injected them, but rather for the highest level physician or surgeon to save their face and even their life. As I stated earlier, someone like myself who's performed so many different lip procedures, both non-surgically and surgically over a 25-year career, has a deeper understanding of what to do and, more importantly, what not to do than a nurse or a physician's assistant. That's obvious. I approach lip filler placement by first hearing from my patient what bothers them the most about their lips or what they want to see enhanced or accentuated. Typically, my patients who are experiencing normal age-related changes focus on vertical lip lines, thin lips, and downward turning of the outer corners. My younger patients tend to focus mostly on lip volume and lip border accentuation. For the purpose of volume enhancement, I like the softer hyaluronic acid fillers. Hyaluronic acid fillers come in a range of essentially different levels of thickness. For example, I perform a cheek volume enhancement at the bone level using a unique technique to deliver the material and create significant improvement in cheek definition. For this objective, I use thicker hyaluronic acid fillers such as Juvederm Ultra Plus and Juvederm Voluma. For lips, I use softer hyaluronic acid fillers such as Restylane, Restylane Silk, Juvederm Ultra XC, and Juvederm Volbella. These less viscous fillers that are preferred for the lips as their physical properties allow for more natural movement, such as talking, kissing, and smiling. Generally, the softer and less viscous the filler, the more the material can adapt to the constant facial movement. But it also doesn't last as long. In order to reduce the probability of complications, I approach non-surgical treatments like injectable fillers the same way I approach surgery. You may not have thought of this, but as soon as the skin barrier is entered, the treatment is invasive, therefore subject to many of the same potential complications as surgery. Lip enhancement begins with planning and having a shared vision between the patient and the doctor for a desired result. My style is to create balance with the other facial features so lips look better but don't look like they don't match the rest of the face. Something worth mentioning is that a growing number of men are actually coming in and during an overall facial evaluation are recognizing that subtle lip volume correction can be natural and masculine. Social media platforms, which are driven by attention and in particular shock to generate more attention, have created in some ways a new aesthetic which is appealing for some people. I'm not one of those people. I see too many younger people with naturally full lips show themselves being injected and end up looking exaggerated. A patient will ask why a particular celebrity who can afford the best doctor can have such large and artificial looking lips. I explain that it's mainly because that the celebrity and their doctor share the same exaggerated aesthetic ideal. In other people, their lips look large and overdone due to the combination of choices. The choice of material by the doctor, a complication, and of course, choosing a low-cost medical provider who rushes to make up for money lost in discounting. That's particularly scary. You really do end up getting what you pay for. I've always believed in every face having a unique character that should be preserved whenever any aesthetic procedure is performed. There's a difference between enhancing or accenting and exaggerating. This is why making a choice of doctor comes down to expertise and artistic style. I also believe in the importance of communication skills and empathy. As an artist, I tend to apply the golden ratio, which is a proportion of 1 to 1.6, and is found in nature in many beautiful things. The golden ratio notwithstanding, I customize to ethnicity and my interpretation of an optimal balance. As many patients request a less is more approach, I apply a conservative volume of filler for subtle enhancement. I use cannulas, and my objective is to minimize the times that the skin is poked, to minimize bruising and swelling so that my patients can go back to their day without any issue. This is in contrast to celebrity doctors on TV and social media who are perceived as experts who use multiple pokes through the lips to add filler. It's important to understand that every entry point of the needle through the lips is a possible risk of more bruising or lumpiness that requires additional recovery time, or even potentially needing to dissolve the filler and redo the procedure. As far as follow-up is concerned, I routinely see my patients in 2 weeks and determine with them if additional volume would be of benefit. I feel it's better to add later than to overfill and have to dissolve. In fact, most of my patients are people who come to me for years. As opposed to the transaction-driven medical retailers, my patients and I have long-term relationships I essentially become their primary care doctor for beauty, and I help them understand if the latest injectable or device that they've heard about is potentially of value for them. The popularity of lip fillers can create a false equivalency between the highest level physician and the injector with a social media account. The take-home lesson is to be mindful of the commercial goals of companies selling fillers as well as the commercial goals of low-quality medical retailers. Successful people throughout the world never pay more than they have to for anything. When it comes to accomplishing something that they want and value, successful people seek out experts whose time and attention ensures them having a greater chance to have successful outcomes. A highly qualified and experienced doctor can help you look your best while minimizing the risk of serious complications. Complications can occur in anyone's hands, but filler complications require quick and competent management by an expert. If you're on a plane, you would want the most highly skilled and experienced pilot, since a split-second judgment in a potentially disastrous event can have a tremendous impact on you and the people who care about you. I hope you found this information helpful. Thank you for your question.